There are certain medications that are notorious for causing memory loss. Some that I often see with my patients are medications such as like antihistamines. Take an antihistamine the next morning, you can feel kind of groggy, kind of out of it, maybe a little memory loss. Also, things like sleeping pills can do it as well. TCAs, tricyclic antidepressants can do it. Opioids, other medications. That's not the full list. But meds can contribute to memory loss for many of us, especially with certain medications. Number two, let's talk about underlying medical conditions. Certainly, there are the dementias, which we know is not just memory loss, but memory loss and like a change or / loss of function, right? But with dementias, oftentimes memory loss is a key of that. But there are other underlying conditions that can cause memory loss too, not just dementias. And there's a number of different types of dementias. I need to remind you, it's not just Alzheimer's dementia. Okay, there's other types. By the way, I'll link a video here. If you don't see it, just let me know. I'll do that so you can check out some other dementias. But other underlying diseases, thyroid disease, huge. If somebody comes to me with memory loss, one of the first things I'm doing is checking a thyroid number. Okay, liver disease, kidney disease, all of those things, depending on the severity and what's going on, the other conditions, literally can cause memory loss. So one of the things I'm doing at first is checking a thyroid, checking kidney, liver function tests, checking blood counts, etc., because that can play a role. All right, next thing, depression and anxiety. I know a lot of people don't understand this or don't realize how much anxiety and depression literally can impact our entire lives. It also can impact our memory. It doesn't have to be a long-term impact, but certainly with exacerbations or sort of acute bouts of anxiety and depression, our memory can be impaired. And not just that, but also things like our concentration and sort of other things. So if you feel like, gosh, why am I so forgetful? I'm not remembering this, that. Anxiety, depression, for many of my patients, memory loss has been a part of that, okay? All right, the next thing is one that probably is self-explanatory and you're not surprised by it. It's alcohol and drugs certainly can do it. But moving on, let's talk about conditions that affect the brain in and of itself, okay? What am I talking about? I'm talking about strokes, I'm talking about tumors, I'm talking about brain tumors, brain infections, okay? Blood clots in the brain, things like that. Any of those things and more, by the way, can cause memory loss, conditions that actually affect the brain, okay? And by the way, if you didn't know, this video is all about 9 things that can cause memory loss. Some of the memory loss that these things cause can be long-term, sometimes it can be short-term, sometimes it's reversible, sometimes it's not, etc. Okay? Next thing is sleep, okay? How hard is it to remember things when you have not gotten enough sleep? It is tough. Lack of sleep is really, really, really difficult on everything, okay? Let's just be clear, but also on our memory. Okay, so memory loss absolutely can be a function of not getting enough sleep. Decreased B12, vitamin B12 deficiency. This is a whole nother lab that I check as well when it comes to memory loss. I'm checking your B12 as well because that can cause sort of memory changes, okay? And write in the comments, by the way, if you deal with memory loss or have at some point in your life, and what was the cause of it? Why did you have it? What was discovered? How did you overcome it? Or did you not be able to overcome it? Please share your story because I always say what you write in the comments often helps other people. Next thing is head injuries and concussions, okay? So not just like the strokes and brain infections, etc., but head injuries and concussions. That is often a symptom I see in some of my patients who experience concussions is some memory loss along with other symptoms. And the final thing is age, okay? We can see some memory loss with age. That is not the same thing as dementia. But as we get older, we can have some memory loss. Now, there are other causes of memory loss, but those are a few reasons why you might have memory loss. Again, write in the comments if you have it. I'm Dr. Jen Caudle. Please subscribe to my channel. Follow my page on Facebook. I'm on TikTok, Instagram, LinkedIn, WhatsApp, Threads. You name it. Follow me everywhere. Go to my website, drjencaudle.com, to sign up for my free health newsletter. Guys, I love you.